We're all about focusing on the facts. So when a Georgia Emergency Management Agency report said critical care beds are at a premium in Bibb, Houston, and some other central Georgia counties, we wanted to take a look. But Zach Merchant tells us understanding how some individual hospitals are affected is challenging.
Coliseum Health System CEO Stephen Doherty says during the pandemic, more critical care beds are empty in his hospitals than usual.
Typically we're 80 to 85% capacity in the critical care beds on a day-to-day basis when we're not in the pandemic.
So your critical care beds are less full, significantly less full now than they are during typical normal operating times.
As I'm talking to you today, that's a true statement.
He says Coliseum has 40 critical care beds and can add 10 more in surge capacity. Right now, only about 20 beds, or 50%, are filled. That seems to contradict a series of reports from the Georgia Emergency Management Agency that say over the past 6 days, about 90% of critical care beds in a region that includes Bibb, Houston, and Peach counties have been full. That would leave about 10% available. So how do you make sense of that?
But I don't know if they're reporting our normal capacity or our capacity with surge.
GEMA spokesperson Lisa Rodriguez-Presley says the agency's totals do include surge capacity, the number of critical care beds a hospital could make available if patient levels increased.
That is correct.
She says while Coliseum might not be too full, other hospitals in the region could be seeing higher volume.
What is reality for one hospital, that hospital that's across town may be experiencing something completely different.
Navison Health and Houston Healthcare declined repeated requests to say how many critical care beds they do have available. In a statement, Navison said they have appropriate capacity, and Houston Healthcare said they are meeting the needs of their patients. Zach Merchant, 13 WMAZ News.
Coliseum CEO says the cancellation of most surgeries is responsible for the increase in available beds at his hospitals.